Bonjour tout le monde. Hello everyone. Welcome to today's online event featuring a presentation on the role of internationally educated health professionals in addressing Canada's health human resource crisis, ending underutilization through systems change. Before we begin today's event, we would like to begin with an acknowledgement that N4 is hosted at CHEO, which is located in Ottawa, Ontario. Ottawa is built on unceded Algonquin Anishinaabe territory. The peoples of the Algonquin Anishinaabe Nation have lived on this territory for millennia, and we honor them and this land. Their culture and presence have nurtured and continue to nurture this land. We also honor all First Nations, Inuit, and Métis peoples and their valuable past and present contributions to this land. My name is Mariah Maddock, and I am a project coordinator with N4. I have the pleasure of hosting today's webinar. My co-host is Andrew Tomeyer, who will be monitoring the question and answer and chat box today. And I am now pleased to introduce you to today's speakers. And speakers, I am going to invite you to turn your video on as I introduce you. Our first speaker is Joan Atlin. Joan is Director of Strategy, Policy, and Research at World Education Services. In both staff and consulting roles, she has led and executed policy and program initiatives focused on professional licensure and workplace inclusion of internationally educated professionals. For over 5 years, Joan served as Director of Programs at the Toronto Region Immigrant Employment Council. Her experience includes developing profession-specific solutions in health and engineering. Joan has participated on national and provincial level task groups, including the National Task Force on International Medical Graduate Licensure, and recently on the Bridging and Laddering Task Force of Ontario's Staffing Supply Accelerator Group for Long-Term Care. Welcome, Joan. Thanks so much for joining us today. And our next speaker is Caroline Ewan. Caroline is a cross-sector research and policy analyst and alumnus of the University of Toronto Munk School of Global Affairs and Public Policy. Between 2019 to 2020, Caroline was the research and strategy specialist supporting the launch of the Miriam Asifa Fund in Canada, a philanthropic fund supporting immigrant and refugee labor market integration and economic empowerment. Prior to this, she worked at the Canadian International School in Amman, Jordan, and at the Immigrant Educational Society, also known as TIES, in Calgary, Alberta. She recently co-authored the policy brief, addressing the underutilization of internationally educated health professionals in Canada, what the data does and doesn't tell us. Caroline is a strong advocate for evidence-based decision-making and collaborative approaches that connect policy to implementation. Welcome, Caroline. Thanks so much for being here. Today's webinar is being recorded and will be uploaded to our N4 platform. We will share this with you as soon as it becomes available. Should there be any technical issues during this webinar, we will inform you with details for an alternate makeup session. And before we begin today's webinar, we would like to take a moment to introduce you to our platform features and help enhance your participation experience. Throughout today's session, we invite you to write your questions to Caroline and Joan in the Q&A window. And we know that sometimes many of you might have similar questions or be interested in a particular response. So today you have the option of upvoting a question. Please upvote questions you're interested in hearing the answer to, and we will make sure we prioritize these questions to our speakers first. And our speakers today have no conflicts of interest to declare. And with that, let's jump right into today's webinar. Over to you, Caroline and Joan.
Great, thank you so much. Thank you for inviting us to join you today. We're going to be speaking, as Mariah said, on the role of internationally educated health professionals, or we'll call them IEHPs throughout the presentation, in addressing Canada's health human resource crisis and in ending the underutilization of IEHP skills and talents through systems change initiatives. So before we begin, I just wanted to situate this a little bit in terms of who World Education Services is and why we're engaged in this work. Many of you will likely have heard of World Education Services and know us as an academic credential evaluation, academic credential equivalency evaluation service, and that is the core of what World Education Services does. We're one of 5 designated service providers with IRCC for economic stream immigrants to Canada, and we do many hundreds of thousands of academic credential equivalency assessments annually for potential newcomers to Canada. However, we are a social enterprise and we have a broader mission, and you can see our mission there on the slide, which is to help people learn, work, and thrive in new places, and to help society recognize the value of people's education and experience. Working towards a mission where ultimately everyone is able to put their education and experience and skills to work anywhere in the world. WES is based in the United States and in Canada. And in order to drive that mission forward, in addition to our credential evaluation work, we have a whole program of social impact work, research work, policy advocacy work, and program and partnership work around catalyzing solutions to move towards ensuring that this mission and vision come to fruition. And that is really how and why we're engaged around the issue of internationally educated health professionals in particular, and why we got so engaged on this issue through the beginning of the pandemic. So in terms of what we're going to try to cover in the next half hour or so, want to set a bit of context for sort of why this issue, why now. We have a very short video to share that brings the voices of IEHPs, internationally trained physicians, to the fore. Caroline is going to speak to some statistics around and really set the context around the underutilization of IEHP skills. And then I'm going to speak to some elements of thinking about what a pan-Canadian strategy and provincial and territorial strategies for IEHP integration would look like. What would the elements of that strategy be? What, if anything, has advanced during the period of the pandemic towards solutions? What would it take to get to a systemic solution, and a little bit about how WES is contributing to that. And then we hope to open the floor to, we'll open the floor to comments and questions, of course, and to really put the question back to everyone here. I'm sure there's a lot of expertise in the room here about what our collective vision is for a comprehensive strategy to address the integration of IEHPs from immigration through licensure and to workplace inclusion. So with that, I'm going to just quickly, before we get into that, we wanted to get a quick check of who's in the room in terms of what sectors people represent. I know that N4 has participation from across the health sector, settlement sector, and other sectors. And so it'd be really helpful for us and probably for others on the call to get a sense of who's in the room. So we'll just ask people to quickly respond to the poll. Just give a moment for that. And then Mariah, as soon as you've got some responses to that, we can just share those up. I don't know, Caroline, if you need to stop sharing in order for Mariah to do that. Oh, there we are. So about 42% of folks on the call today are from the health sector, another about 20% from the settlement sector, and 18% of people participating from government, and a small percentage from academia. So that's really interesting to see, and great to have so many participants from the healthcare sector here with us. Thank you for that. The second question is, again, a really quick poll question, just to ask about your level of familiarity with the issue of IEHP integration and the solutions to the underutilization of IEHP skills. So we'd ask you to just quickly tell us how familiar you are with this issue. I'm sure some of you are very familiar. I'll just give folks a moment to respond. And how are we doing with responses on that one? Don't want to take too much time on that piece. So it looks like the sort of the plurality is in the middle there, a little or somewhat familiar. About 30% of folks on the call are quite familiar, and I know from the registration list there are certainly many folks on the call who are IEHPs themselves, and then about a quarter who don't have very much familiarity with the issue. So thank you. That's really useful to know as we move into this. So with that, I'm going to pass it over to Caroline to do some context setting for this conversation.
Thanks very much, Joan. So it's interesting to see through the poll results that there is, a good degree of familiarity with some of these statistics. So we won't spend too much time here, but we do want to emphasize, what we all know, which is that the COVID-19 pandemic has clearly exacerbated some long-standing issues in Canada's healthcare system. In terms of staffing shortages, at the start of this year, there were over 130,000 vacancies in the healthcare and social assistance sectors, and a really significant number of these in nursing. We also see increased strain on the system from staff burnout. Again, this is really acute in the nursing profession. StatsCan data show that nearly a quarter of nurses are intending to leave their jobs or change jobs within the next 3 years. And there are also issues around gaps in access to care. So widespread physician shortages, and particularly, inequitable access to healthcare services in rural and remote communities. And despite this really incredible strain on the healthcare system, and despite Canada welcoming record numbers of temporary and permanent residents, a remarkable proportion of IEHPs remain unemployed or underemployed in positions that really don't fully use their skills and training. So in 2020, this number was nearly half, or 47%, according to Statistics Canada. We're about to share a lot of statistics and numbers, and just to kind of remind ourselves of the faces behind these numbers, I'm going to stop sharing my screen for a moment and ask the N4 team to pull up a brief video from a campaign called Equal Chance from the Institute for Canadian Citizenship. And this campaign was focused on immigrant physicians, but important to bear in mind that these issues are, they affect IEHPs across a range of occupations.
أهلا وسهلا بكم.
Namaste.
Assalamu alaikum.
My name is Dr. Mithi Laurie.
Je m'appelle Prinsila Mukoko.
Sugandha Agarwal.
My name is Harry Tabrizi.
I practiced medicine in Egypt for 10 years.
In Bogota, Colombia for more than 6 years.
Au Cameroun pendant 2 ans.
For 15 years.
For 20 years.
I became a doctor because I wanted to make a difference in people's life.
To care for others in their most vulnerable times.
To serve the community.
Je suis devenu médecin parce que je voulais pouvoir venir en aide aux gens.
I have completed and excelled in the Canadian qualifying exams.
I meet Canadian standards, but I'm prevented from being your pediatrician.
Your anesthesiologist.
Your psychiatrist.
Your obstetrician and gynecologist.
I am a doctor.
I am a doctor.
Je suis docteur.
I'm a doctor.
But not in Canada.
Great. Thanks so much, Colleen, for sharing that video. We want to continue the webinar here by highlighting what available data tells us about the contributions of IEHPs to the health workforce in Canada. And so from labor force survey data, we know that individuals who arrived to Canada as immigrants make up over a quarter of the healthcare and social assistance workforce, including nearly a third of all physicians and nurses. In some major urban centers, over 70% of nurse aides, orderlies, and patient service associates, or PSWs, are immigrants. And many of these are racialized immigrant women. In Canada, 86% of the workforce in long-term care are women, 89% of the home care workforce are women, and data from the CCPA also shows that a third of nurse aides, orderlies, and PSWs are racialized women, and 38% of the home care workforce are racialized women. So in terms of outcomes, what this looks like is a real overrepresentation in certain occupations and sectors, such as home care. In addition to really substantial contributions to the healthcare system, available data also shows really widespread underutilization. As we noted earlier, in 2020, data showed that nearly half of IEHPs were unemployed or underemployed, meaning they're working in roles that really don't fully utilize their skills and experience. In the context of nursing, for example, about a quarter of recent immigrants working as nurse aides, orderlies, or PSWs hold at least a bachelor's degree, and of these, nearly 70% hold a nursing degree from abroad. And when you look at who's actually working in their field in nursing, only 37% of IEHPs with a degree in nursing were, as compared to 78% of those trained domestically here in Canada. And if you look at figures for other health occupations, including medicine, pharmacy, physio and occupational therapy, lab techs, respiratory techs, you'll see a very similar picture. And I keep using the term what available data shows, and this is a really important point to highlight because right now we don't fully understand the true extent of the problem because we don't really know how many IEHPs are really in Canada, where they are in the country, and the extent to which they're facing barriers to equitable employment in the health workforce. And so to kind of illustrate this a little bit, we're using an example using data from the nursing occupation in Ontario from 2019. So in that year, we know that 205 new permanent residents declared their intended occupation as nursing. In that same year, just 10 temporary residents declared their intended occupation as registered practical nurse. This is according to IRCC data. In that same year, 860 IENs registered with Healthforce Ontario's Access Centre, which is a service run by the provincial government that provides an employment matching service to IEHPs. And really remarkably, in that same year, over 14,000 IENs were pursuing professional registration with the regulatory body in Ontario, the College of Nurses, and only about 2,000 were eligible for full licensure that year. And what this shows us, right now, different agencies that capture data on IEHPs like government, regulators, employers, research institutes, it's not happening in a coordinated or systemic way. And this is a really significant problem because what the available data does show us is a really high degree of underutilization that's being shaped by things like gender, race, immigration status, but it's not being effectively tracked or accounted for in a labor market that's facing really serious urgent staffing shortages. And the data on temporary residents is actually very interesting because recent studies have shown that a large proportion of women who entered Canada as caregivers through the caregiver program as temporary residents, a large proportion of those hold a bachelor's degree, and many of these in nursing. But many of these folks aren't being asked, about their intended occupation or their educational background. And without accurate data, we can't begin to address these problems in a meaningful way. There are growing calls for an HHR data strategy, and IEHPs really need to be a part of this strategy. I'll just mention here as well, WES recently put out a policy brief outlining what the data does and doesn't tell us. And we'll get the N4 team to pop that in the chat for folks who are interested in reading it. And so at this point, I'm going to hand it back to Joan to speak to how we might move towards a pan-Canadian strategy for IEHP integration.
Yeah, so I think the statistics that Caroline shared have given us a sense of the size and scope, even though we don't, as we say, have accurate data, but even though, the kinds of numbers of those pursuing licensure in Canada gives us a sense of the size and scope of this talent pool. and the underutilization of their skills. So what I want to turn to now is to turn our attention to what solutions could look like, what's been done, what's been happening throughout the pandemic, and where we could go from here. There are many programs, initiatives, best practices across the country and internationally around the integration of internationally educated health professionals. But what we don't have is an integrated, holistic, systemic, comprehensive approach at the program policy or the programmatic level. And to get there, we really need to consider all aspects of the IEHP journey, from immigration and the challenges at that point in the journey, through professional registration and right to workplace integration and retention in the healthcare workforce. And of course, if you think about these three levels, there are a myriad of stakeholders across each of these, across the immigration story, the registration process, which includes education and employer stakeholders, as well as employment integration. So what I want to do, and ultimately underlying all of this, is the conversation about a health human resource strategy, pan-Canadian and provincial and territorial. And so the issue that we really want to look at is how we can ensure that internationally educated are considered as a core and integral part of that healthcare strategy. Canada is a country of immigrants, and our healthcare workforce has always included both domestically trained and immigrant and internationally trained health professionals. So I want to dig in a little bit, Caroline, if you could flip to the next slide, just dig in a little bit to some examples of the kinds of policy proposals that we've been making along with others around these elements. And you'll see at the bottom of this slide, there's a link to a policy brief that we produced that along with, that WES co-authored with Naomi Alboim and Karen Cole, that was published by the Canada Excellence Research Chair in Migration in March. In terms of removing barriers related to immigration status, what we're really looking for is access to professional registration that's facilitated for both permanent and temporary residents. And making sure that those who come as temporary residents, as Caroline was just describing, have access to making a fast transition to permanent residency. To bring in more healthcare workers as permanent residents, we can be looking at provincial nominee programs and targeting spaces in the federal economic immigration program, while still being careful about Canada's obligations under the World Health Organization's principles on ethical international recruitment. For those who come as temporary residents, we need to be looking at facilitating access to open work permits so that they can work within their fields, ensuring that they have access to provincially funded or federally funded bridging programs that often provide some of the orientation and recent work experience that people need to move through the licensure process, as well as providing conditional registration for those. There were stories in the news, if you may recall, a couple of months ago about a group of nurses who had met all of their requirements with the College of Nurses in Ontario, had come under other temporary programs, but had not yet received either a renewed work authorization or permanent residency because they'd come under other programs and they were stuck in our immigration backlog. In terms of facilitating professional registration, we're really looking towards ensuring that IEHPs can navigate a system that's fair, that's coherent, that's affordable and accessible, that is relatively fast in terms of moving through all the necessary stages, and that's sustainable in terms of all of the elements of assessment and training so that qualified applicants can make their way through to registration. That can involve things like ensuring that programs that bridge gaps for people are widely available, that they're integrated into the health education system, that they're funded not as one-offs or pilots, but that they're integrated through operating grants into our healthcare education system, and that they're scaled up based on the evidence of where there is most need, where there is a supply of internationally educated health professionals, and where there is demand for them. And of course, this also means including funding and facilitating support, both for the IEHPs themselves, because this process can be extremely expensive, and for employers who are providing workplace experience elements who need support for preceptors and clinical supervisors. Also ensuring that there is access to things like practice-ready assessments and other competency-based as opposed to time-based modes of assessment, and that those are available for all relevant health professions. Including in terms of enhancing employment opportunities, we're looking, of course, at IEHPs having equitable access to employment in inclusive workplace environments at levels that are consistent with their skills and experience. And there are many initiatives out there that are looking to advance that. Ultimately, we're talking about developing an HHR strategy for Canada that includes IEHPs and that can integrate and retain them. That means it includes IEHPs in an intentional way as an integral part of healthcare delivery that's informed by principles of equity, diversity, and inclusion, that's informed by disaggregated data on internationally educated health professionals and on the patient population, and that's led by government and really brings together the full range of stakeholders that need to be at the table to move things forward. We're not there yet. We're still a long way from this, but the pandemic has certainly catalyzed many initiatives that are pointing us in the right direction. There is momentum on this issue, and increasingly even in the last days, as you know, the First Ministers' conferences and the discussions of healthcare funding and a health human resource strategy for Canada, the issue of IEHPs is becoming part of the conversation. This slide deck gives a gives a bit of an overview of some of the more recent initiatives. It is by no means exhaustive. It's just a couple of examples. The green arrow across the top looks at some examples around internationally educated nurses specifically, and the blue arrow along the bottom highlights some legislative advances, some major stakeholder groups that have been weighing in on this issue, and some other federal initiatives. So I'll just speak very quickly to a couple of these. At the top there on the left, you see an initiative that was announced by the Manitoba government in the summer of 2021, which offered up to $23,000 in funding for individual IANs to support them in covering all of the costs to make their way through to recertification and relicensure in Manitoba. And that program was oversubscribed almost immediately after it was announced, and certainly not only by IANs who were already settled in Manitoba, but by IANs from across the country who saw that as an opportunity. The Ontario government announced something similar in the fall of 2021, again offering tuition support for personal support workers who were looking to bridge to RPN or RPNs who were looking to bridge to RN. And that those grants included additional funding specifically for IANs to cover some of the additional costs that internationally educated nurses encounter. Another important initiative in Ontario is the Supervised Practice Experience Partnership between the College of Nurses and the Ontario Government, Ontario Health. And that initiative is really about helping IANs who have met all of their licensure requirements except for recent practice, because as Caroline described, many IANs will have come to Canada under other programs. And in the time that they've been working towards permanent residency and registration, their recent practice will have expired, their safe practice requirement. And so this program provides funding to hospitals and to the long-term care system to provide those 3-month supervised practice experiences to allow people to meet the recent practice requirements and also to demonstrate and to meet the language proficiency requirements through a workplace experience rather than language exams. There are a number of others. I'll just mention the BC announcement supporting IANs in April, consolidating a number of provincially based assessment processes for IANs, offering about $9 million in bursaries, again, directly to IANs to support the costs of making their way through the process, and creating nurse navigator positions to help IANs navigate the system and navigate the process. And as I said, that's not an exhaustive list. There are many other examples across the country. On the blue line along the bottom, the one on the far left refers to some legislative changes in Ontario that began with non-health professions, but have now been extended just recently to health professions to, among other things, remove requirements for Canadian experience as part of the licensure process As you can imagine, many IEHPs find themselves in a catch-22 if the professional regulator requires a time-based period of Canadian experience or recent practice that they don't have a way of obtaining. That's particularly acute, of course, in medicine, where the main way of obtaining that, meeting that experience requirement is through obtaining a residency, and there's very limited access to residencies for international medical graduates. There are many major health stakeholders who are beginning to speak on this issue. The Canadian Federation of Nurses Unions, for instance, issued a position statement in February of 2022 that recognizes the contributions and the underemployment of IENs and supports a multi-pronged approach to recruitment and retention of IENs. Most recently, as you're probably aware, the House Standing Committee on Health has held a series of hearings on health human resources, and we were very interested to see that the Canadian Medical Association, the Canadian Nurses Association, and the College of Family Physicians jointly made a submission on health human resources, where they had 8 major pillars to their strategy, and the 6th of those pillars was in fact getting training and licensure for international medical graduates and internationally educated nurses. And they've laid out some strategic ideas, so that those are really important advances to be hearing these major healthcare voices. And I know there are probably representatives from some of those organizations on the webinar today, having those come forward as proposals from key healthcare stakeholders. Health Canada has been holding also a series of symposiums on health human resource planning, and they have included a range of stakeholders, including those who have spoken to the issue of IEHPs and the need for the inclusion of IEHPs systematically in that strategy. The Canadian Academy for Health Sciences has been commissioned by Health Canada to do an assessment of the Canadian health workforce, and they are actually holding consultations this week as we speak and next that are open to stakeholders, and WES and many others will be participating in those from the perspective of integration of IEHPs. As well, the federal budget, the most recent federal budget, included a significant amount for the Foreign Credential Recognition Program, including a focus on support for projects that will contribute to licensure for IEHPs. So as you can see, there is a great deal happening on this front. And yet, what we still don't have is a coordinated strategy across all stakeholders. And we can ask ourselves, why is this not so hard to crack? And of course, a very important part of the answer to that is the incredible range of stakeholders, the complexity of the process, and the range of stakeholders who are involved. And I'm not going to speak to all of these. Many of you represent some of these sectors, but in order to deal with this issue across the ecosystem, and to take this momentum forward, we really need strategies that engage all of these stakeholders so that we can address the issues from immigration through registration and into the workplace. And we believe that we're really only going to be able to get there by engaging the full range of stakeholders who have a role to play, including IEHP organizations themselves, those that represent internationally educated pharmacists, physicians, nurses. They know what the problem looks like from where they sit and have important contributions to make in terms of policy and programmatic suggestions. In terms of how WES has been approaching this issue, we at the beginning of the pandemic, we got quite engaged. If you sort of start looking from the bottom of this pyramid here, we were approached by the long-term care sector, who was facing, of course, incredible shortages of PSWs, registered practical nurses, and were interested in accessing immigrant talent and the settlement sector and the employment services sector to recruit. That conversation quickly turned into a conversation about the fact that there are likely hundreds, if not thousands, of internationally educated nurses already working as PSWs in the long-term care sector. And we began to develop with Bridge program leaders and the sector some proposals that we jointly put forward to government, which have resulted in some of the kinds of announcements that we referred to in the earlier slide to support IN bridging and laddering. We also pulled together a coalition of internationally trained physicians groups led by immigrant physicians themselves who are seeking licensure in Canada, in Ontario particularly, and organizations who are serving them, settlement and employment services organizations. And that group has developed a set of advocacy proposals around increasing access to residency for IMGs, ensuring that practice-ready assessment is available as a pathway in Ontario as well. It's available in 7 provinces across the country, but not in Ontario, as well as looking at the clinical assistant model that exists in several provinces and what it would look like to roll that out in Ontario. That work really led us to thinking about needing to move to the systems change level and really focusing on an Ontario strategy that would be a multi-stakeholder process, including all of the stakeholders that we saw on the previous slide, to develop a comprehensive HHR strategy that intentionally includes a systemic approach to the integration of IEHPs. And of course, extrapolating that up to a pan-Canadian strategy and a pan-Canadian approach to an HHR strategy, which includes internationally educated health professionals. So that's some of the work that we've been doing, and of course the policy papers that we've pointed to over the course of this presentation. We are really excited about the work that the Newcomer Navigation Network is beginning on internationally educated health professionals, and really looking to work with N4 and to collaborate on how do we advance the momentum that has begun. This is not new work. I think Mariah referred to, I had sat on the National IMG Licensure Task Force. That was in the early 2000s. And that group brought together regulatory bodies from across the country, ministries of health and health education, created some advances, but did not include all of the other stakeholders that were on that stakeholder map. And we really believe that in order to move this work forward, we need all of those stakeholders present, and we need to take the momentum and the best practices, because the technical solutions are there. There are best practices across the country and internationally for how to do this and do it well. And so we really look forward to taking advantage of the momentum that the pandemic unfortunately has created in terms of tremendous shortages in healthcare, and the interest now and the political will and the willingness to invest in effective, systemic, and comprehensive integration of IEHPs into our healthcare system. And we look forward to working alongside all of you on those solutions and on that systemic solution. So at this point, we'd like to throw it open for questions, comments, thoughts. We're very interested in hearing the thoughts of those on the webinar around your vision for what it would look like to create a systemic solution for the integration of IEHPs. And I'm sure that there's a lot of thinking and expertise among others on the call. So thank you.
Well, thank you so much, Joan and Caroline. I just want to acknowledge the phenomenal work that you have done in this area to address this really important issue. We have several questions, and so I'm just going to jump right into them. And the first question at the very top is, are you aware of any work being done at the national level to bring together key stakeholders to further discuss the barriers encountered along the pathways to licensure?
Yeah, I mean, as I referred to, I'm I'm not aware of anything specific to IEHPs right now, but what is happening right now, which we referred to in the presentation, was, for instance, the Health Canada initiative, a series of symposiums and the commissioning of CAHS on a study, and they are inviting participation. The consultations that the CAHS is holding are open, and they're inviting policy submissions, documentation, research, and evidence from across the country. And these we really see as opportunities to invite participation in those processes. We've participated actively. We've tried to ensure that other that IEHP organizations that we work with are getting their voices heard and their policy proposals. So I think that, just in the last 2 days, we've been approached by two major, national health reporters with two major media outlets who are covering the conversation, this national conversation about HHR and the federal provincial ministers' meetings, looking to cover this angle and tell the story of where and how immigrant health professionals, internationally trained health professionals, fit into this equation. So there's growing interest, and I think a moment that hasn't existed in the past.
Yeah, thanks so much, Joan. It's very, very exciting. And also for those on the call that might not be aware, N4's mandate did recently expand to remove barriers to licensure for IEHPs with the goal of closing labor market gaps. And so for anyone who's interested or who might not be aware, we will be launching a community of practice in August 2022 with the goal of providing a visual map of the pathways to licensure for IENs and IMGs in Canada, and making some linkages to concrete and actionable recommendations, also providing examples of promising practices. And we're looking forward very much to collaborating with WES on this work. So for anyone interested, please do reach out to us and connect with us on that. So I'll just move into the next question. So it's, even though nurses all write the same exam, they're having to apply to each province individually. So do you think that having a single Canadian license could solve this issue? Have you seen any promising practices in this area?
I got asked that question by a journalist yesterday, in fact. I mean, it's interesting that discussion is coming to the fore again. It's not the first time that's come up either. Of course, licensure, health is provincial jurisdiction in Canada. Professional licensure is provincial jurisdiction in Canada for any regulated profession, health or outside of health. There are certainly rules for, and many regulated professions, including nursing and medicine, have a national body that is responsible for either for exams or for initial assessments. And so there is certainly a role, and that's partly why we've been talking about how it's so important that this isn't only addressed at the provincial level, but that it's addressed nationally. Not only because there are elements of the registration process and certainly the immigration process, which happen at the national level and are fall under federal jurisdiction, but also because of the question of that question of needing to have solutions that are national in scope and not having, each province announce, the next shiny new way of attracting IEHPs and simply competing with other provinces and pulling resources from one province to another. A national approach to this is going to be really important.
Thank you, Joan. And so our next question, first of all, a big thank you from the person posing the question to you, Joan and Caroline, for advocating for IEHPs. And are you aware of any programs that support internationally trained physicians that are similar to the nursing program in Ontario to obtain their recency of practice?
I'm going to pass that one over to Caroline, who has a great expertise in what's happening around the country.
Yeah, so in response to this question, I would highlight the Practice Ready Assessment Program, which is a 12-week assessment program for internationally trained physicians that will allow them to obtain licensure by working under supervision in clinical settings, in as little time as 12 weeks. This program is through the National Assessment Collaboration from the Medical Council of Canada. It's been developed and refined over the last decade, and it currently exists in 7 other provinces, but not in Ontario. So one of the policy measures that we're advocating for through the Internationally Trained Physicians Access Coalition, or ITPAC, is to bring the practice ready assessment model to Ontario, because it has proven to be a very successful program in terms of enabling access to supervised practice opportunities that lead to licensure. There was a small scale pilot that had been proposed several years ago in Ontario. And so we are really advocating strongly in collaboration with the internationally trained physicians that we work with to bring this program to Ontario to expand those opportunities to obtain licensure.
Great, thank you so much for that response, Caroline.
I'd say, one of the challenges for internationally trained physicians, for all health professions really, is the requirement and the importance of keeping practice current and recent practice, which is a requirement in most health professions. And the challenge for people who immigrated over time and have been here in Canada for some time now and have had to pursue alternative ways to make a living and hopefully stay engaged in one way or another in the healthcare system. We know many IMGs, for instance, who go on to do degrees in public health or public policy, is also finding the avenues. Programs like the Practice Ready Assessment are really designed for people who are fairly recently arrived and whose practice experience is current. But how do we create avenues for people who are well oriented to the Canadian healthcare system, have been in Canada for a period of time, are settled here, their families are settled here, they're invested in staying? How do we create avenues for them to ensure that they can have a pathway back to practice as well? Because they're extremely valuable to our system. They're settled and integrated already.
Great, thanks for adding that on, Carolyn, or Joan. Next question is, are there any outcomes for bridging programs or navigators on their success? And maybe I see another question further down, so I'll tie it to this one. Are you aware of any evaluations that have been done on some of the initiatives to support IENs or IEHPs in different provinces?
That's a really good question. I think, part of what happens is that funders, the ministries, federally or provincially, who fund bridging programs, collect success data from those programs. That data isn't widely available. It doesn't tend to get widely published, but there certainly have been studies and there is evidence. I mean, the bridging programs that are bridging to licensure are designed specifically to ensure that people meet licensure requirements. They generally support people through, exam taking and preparing for those different assessments. So the model in general has been quite successful. Part of the challenge is that those programs aren't scaled, is investing in them adequately, having federal and provincial policies that invest adequately to scale those programs so that, the thousands of internationally educated nurses, for instance, or physicians or physiotherapists or pharmacists who could take advantage of those programs, that they're scaled, and where we have need, that those programs are scaled so that they can serve.
Thanks, Joan. And how can academia connect better with the IEHP ecosystem to help facilitate this work? And this, the person asking this question says they are already working with and teaching many IEHPs and want to support their learners in the best possible way.
It's a really good question, and I hope that perhaps some of the N4 work in this direction will, given the vast network that you have, will be able to support that. One network that we are aware of, there is a national network of educators who are working in IEN bridging specifically, and I think we can send along the contact info for that network and circulate it through N4. I'm aware of some profession-specific networks among bridging programs or loose networks among academics. So that's certainly, that might be an idea to pursue through a national network like this.
Great, thanks, Joan. And the pathways to licensure differ by province. So several times in the presentation, a national strategy was brought up. So how would a national strategy account for the interjurisdictional differences?
I think that's why we're talking about both provincial territorial strategies. I mean, the nitty-gritty of registration happens at the provincial level, but in many cases, for both doctors and nurses, for instance, but in many others, there are national assessment bodies involved in the process. So it's both a provincial and a national question, even though ultimately the registration sits provincially. But I think, the best practices, the technical solutions, the pathway to licensure isn't fundamentally different province to province. All of the licensure processes have similar elements. I mean, they're all looking at academic background, they're all looking at skills and competencies, language competency, practice, recency of practice in many cases. The elements are very similar. And so frameworks that look at best practices and that tie together, as we've said, it's not helpful to, for instance, create a lot more provincial nominee spots for internationally educated nurses or doctors or pharmacists or physiotherapists if that isn't tied to a navigation process to ensure that people who come in under those programs are supported financially and through navigation into a system that catches them the minute that they get here and leads them through the process, and where we're not also just competing jurisdiction to jurisdiction for those same folks, and that so that we're solving the immigration problems, the registration problems, the investment in bridging and education, supporting employers to provide those work placements and the integration. The system needs to work as a system, and that's what hasn't been happening, I would say, to date.
Excellent. Thank you so much for that, Joan. And there's a question here asking what makes N4 different to NNAS. I know that might stand for the National Nursing Assessment Service, and how does it help? So I think I will just encourage you to go. Andrew will put the link in the chat with that'll take you to our N4 website. We are not providing direct services to IENs or IMGs. And you can read more about that on our website. I don't want to take away our airtime today with WES, so I'll just have my colleague Andrew put a link with more about N4 and how we help in the chat. So another question here about if there are any programs for pharmacists that you're aware of.
There are. Certainly familiar with the Ontario program. Caroline, Wes, at the beginning of our work on this issue, it's 2.5 years ago now, Caroline actually led a sort of a national scan of everything that was going on across the country, and may be able to provide some information on that.
Yeah, so there are a number of bridging programs for internationally trained pharmacists. There's one at U of T, there's one through UBC. Unfortunately, at this point, seats in those programs are quite limited in terms of the number of available seats. So looking to obviously expand successful programs in that area, is a best practice. There are also number of competency-based assessments for pharmacists. I will be happy to share out some of this information in the follow-up materials that we send out, but looking at assessing the competence of internationally trained pharmacists through competency-based evaluations as opposed to other processes. And so there are a number of bright spots in terms of programs for pharmacy as well.
Great, thanks so much, Caroline. And I see a comment also on the person who is asking that question. So if anyone else is aware of any programs, please do feel free to connect. That's one of the great things about these webinars is it also provides an opportunity for attendees to connect with one another. So next question is around the timeline. What is the timeline for the development of an Ontario strategy?
I don't have a timeline because we're advocating for the development of an Ontario strategy and hoping that the newly elected government in Ontario will take up that call. I think these conversations are all underway, and they're in Ontario, for instance, there have been a number of initiatives, but tying those initiatives together into a coherent strategy is really a piece of what we're calling for. I mean, our timeline, of course, would be as soon as possible, but this is a big undertaking that involves a lot of system players, and we would certainly hope to see the convening of the kinds of tables that would move us towards those kinds of strategies sooner rather than later.
Great, thank you, Joan. And this next question is directed at Caroline. What are your thoughts on an HHR data strategy in terms of what it could look like, what partners would be needed, etc.?
Yeah, it's a great question. And luckily, there's been quite a lot of momentum in this area recently. I guess the short answer is that, we'll need to leverage what's already being done in a kind of uncoordinated way to make it more integrated and push it towards more interconnectivity in terms of how these different data sources speak to each other. So very interestingly, one of the recommendations put forward by the CMA, CNA, and CFPC to the standing committee was around, creating an HHR data strategy. And so one of the specific points there that they mentioned was, creating a center of excellence for HHR data collection and leveraging, a national body like the Canadian Institute for Health Information, or CIHI, in terms of leading that work. But importantly, immigration data needs to be included here as well. So, landing file data on field of study and attended occupation of temporary and permanent residents. This would also be a really important piece to be integrated into this strategy, as well as data from regulatory bodies, occupational regulatory bodies, employers, etc. So there is a lot of momentum in this area, and so what we're advocating for is just for the IEHP component to be integrated into these broader calls for an HHR strategy.
Great. Thank you so much, Caroline, for that fulsome response. Unfortunately, we are approaching the end of our webinar today. However, I can see that there are several questions here, and we will be moving these over to N4's Meeting Place, which is an online moderated discussion forum, and we will invite Caroline and Joan to respond to those questions there. As well, we encourage you all to engage with each other in the online moderated discussion forum, as there might be information we can share with each other, coast to coast and sector to sector. So I do want to, again, just give a really big thank you today to our speakers, Caroline and Joan, for engaging, for taking the time to present on all of the work that you've done. And also I want to thank the audience today for your participation and engaging with us. For those who are interested in the N4 work that is being done around IEHPs, we do encourage you to go on over to our platform and read about some of the tools and resources that can be accessed there. There's no cost to join N4, and membership is open. So please do sign up to become a member if you're not already. And if you missed any part of today's presentation or would like to watch the session again, we will be posting the recording on the N4 platform within the next week. And we do want to continue the dialogue that we're starting here today. We're continuing. And so we do encourage you all to go to N4's Meeting Place. We've also curated several resources related to today's webinar topic, and we will be linking these with the recording. So if you've registered today, you will receive an email notifying you that it's available with a link to the various resources that Joan and Caroline shared with us today. And following today's session, you will be invited to complete a survey to share your feedback. This is a really brief survey that helps us to continuously improve our webinars. And it also helps us to seek out new webinar content that's really responsive to topics that you are interested in learning more about. So thank you all for joining. And I do want to pass the final word over to our speakers today. Joan and Caroline, do you have any final remarks for the audience today?
I don't actually, other than just to really thank you for the opportunity and to invite anyone who's on the call to reach out to us as well if you're interested in continuing the conversation around where this strategy needs to go and what role your organizations might play. Thank you. Thank you so much for the opportunity.
Great. Thank you so much for joining, everyone. And we hope to see you again at a future N4 event. Stay safe and be well.